with these respective types of cancers. Now, let's move on. The protective effect has been described for acute lymphoblastic leukemia and neuroblastomas, also for Hodgkin's disease in case of long-term breastfeeding, more than 6 months. I didn't discuss Hodgkin's disease here. Interferon gamma is present in milk during the whole breastfeeding period at quite reasonable concentrations. Transmission of interferon gamma and additional cytokines should interfere with this postulated viral load. Maternal antibodies, particularly IgA antibodies, are present during the entire period of breastfeeding, but they do not pass the intestinal wall, and they are thus likely to act here, and they should show a specific effect, whereas in the case of the protective effect of multiple infections, it's a non-specific effect of many infections, and interferon would clearly fit much better into this. So the anticipated consequences are induction of immune tolerance, no increase of induced tumors under immunosuppression, retained susceptibility to interferons, conditions avoiding multiple infections should add as risk factors, and a syn-carcinogenic interaction with specific factors. Now, if solely mutational events, as frequently postulated, would be responsible for these types of tumors, we would have great difficulties to explain the protective effect of multiple infections, the lower rate of these tumors in subsequent siblings, a protective effect of long-time breastfeeding, the higher risk of children living under high standards of hygiene, absence of an increase under immunosuppression. Now, if we come back to the same scheme and replace this part here by long-time breastfeeding and the production of interferons here within the milk of the feeding mothers, or also with allergic conditions, which have been also shown to lead to the production of interferon gamma and interleukin 13 in particular, we would basically end up here with the same scheme. Now, other agents which could play a role in these diseases, yes, there are, because there's a group of rather interesting agents which have been discovered now 16 years ago in Japan, the so-called TT or Nello or Tokyo tenovars, as they are called. These are single-stranded viruses with a number of open reading frames indicated here, some conserved regions, which are extremely heterogeneous.